Hi, Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma. I was going to talk about recurrent bladder infections in women, but I realized since we take care of men and we have men who get bladder infections as they age, it's both groups, okay? That's the big thing about the bladder. We all end up with the same problems. Now, girls have a more arduous journey with bladder dysfunctions, but as a guy gets older, and the prostate gets larger, they too develop similar things with urgency frequency, waking up at night and going to the bathroom, and occasionally incontinence in them. Incontinence is more common in girls. But both groups can get bladder infections, but it becomes a much bigger deal as we age because the permeability or the ability of the bacteria to break into your system from the inside of the bladder and cause sepsis skyrockets. So there was just an article online somewhere or other, but it was like on CNN or something about sepsis and how important it is to think about just urinary tract infections in women for that, but it's in older women, but we have to think about it in men too. I just had a patient who'd gone to the cardiologist and fearing they were having a cardiovascular issue. He had a great workup with Dr. Marcus Smith, who is this amazing physician here in Oklahoma City, truly a gift. And he said, I can't find anything, and he sent him back my way. And I was looking at him and listening to how he was feeling and these weird chest pain symptoms and everything, and I thought, oh my goodness, he could have a bladder infection. And lo and behold, he had a ureaplasm, which is a kind of an odd bacteria, but it causes a bladder infection without getting white blood cells in there. So it's harder to detect. That's what he had. We treated it. He was fine. But these bladder infections as we age do cause sepsis, do get into our systems. So you have to be aware of that if you're a caregiver for someone who's older, that sometimes the presentation of a bladder infection isn't, oh, it's burning when I'm urinating or I'm having an urgency or frequency. They're just acting funny. And then the thing about it is, why does it happen more in women? The number one cause is what we call vaginal atrophy, or a change in the tissue from lack of estrogen. And one of the key places where estrogen works besides the vagina is the bladder. And so when you have estrogen in the vaginal area, you're going to have good blood flow and good oxygenation to both the vagina and the bladder. The inside of the bladder is then going to stay strong and not fragile. You're going to have bacteria in the bladder that we need, which is they're called acidophilus. They're the same bacteria that you have in the vagina. I mean, when I was first in medical school and through my career, really, we were always taught that the urine is sterile. That's completely incorrect. The urine is not sterile. It has acidophilus in it. We need acidophilus to protect us from the bad bacteria. So in the end, estrogen is very, very safe for the vagina. If you have a uterus, we sometimes have to think a little bit more how we do it. You can use DHEA. There's a product called Intra-Rosa. You can use estriol, which is a milder form of estrogen, which is in some respects the best. You can use estradiol. So tons of choices for girls on how to treat the vaginal atrophy and the urinary bladder atrophy. We also use the Mona Lisa laser and the Emcella to help that tissue heal and get better. So the Emcella's magnetic generated contractions. The Mona Lisa laser is a carbon dioxide laser that puts energy into the tissue and revitalizes the stem cells, which in turn helps the bladder and the vagina. So anyway, urinary tract infections as we age, something that are very manageable and to be aware of. Thanks.